Every good story has a beginning, middle, and ending. And most of us are able to say with some degree of certainty when the pandemic of COVID-19 started. And to some extent, we have over the last 2 years been working through the middle of that story. The question now that faces us is, how does this end? How do we end the pandemic? And to some extent, many countries, including our own in the United Kingdom, have felt that we are at a stage where the emergency response to COVID, to the pandemic, can come to an end. That, however, does not mean that COVID has gone away. And indeed, we have now entered a phase where, although policy has changed in terms of how we respond to the pandemic, we are seeing an increase in cases across the UK and in Torbay following the lifting of restrictions that was announced a few weeks ago. That in itself is not surprising, because the basic dynamics of how the virus transmits and how it causes diseases has not really changed. The one significant change is that we've had new variants that are milder, but are able to transmit between people more easily. So the result is that we have the Omicron variant and the latest versions of that variant that are very infectious. They pass easily from person to person, causing them to become infected, but they do not cause as severe illness as previous variants, such as the Delta, which was the dominant one before. It's important to recognize, however, that despite the fact that the Omicron variant causes a milder form of illness, it is by no means a trivial illness. And the Omicron variant is still capable of causing death and serious illness, particularly in those who are unvaccinated and in those who have underlying health conditions. That has not changed, despite the fact that we have moved into a different phase of responding to the pandemic and are now living safely with COVID. So when we look at the figures as they're increasing again, and we see that increase in the number of new cases that are coming through people being tested, we are seeing it in an increase in the number of care home residents and staff that are reporting infections. We are seeing that increase in the number of people in hospital who are testing positive, some of whom have been picked up because they are in hospital for other reasons and are tested for COVID, and a small number who are in hospital because of COVID-related illness. What we have not seen, and that still remains positive, is the severity of disease that we saw earlier on in the pandemic. So although the number of new cases has indeed increased, we have not seen a large increase in people who need intensive care treatment, for example, and we haven't really seen an increase in deaths overall. A lot of that is due to the fact that our vaccine program continues to offer protection, and people have continued to come forward to ensure that they are up to date with their vaccinations. As I record this, the 4th dose is now available for those who are over 75, those who are care home residents, and those who are over 12 with an underlying health condition. And that is aimed at protecting the most vulnerable, even as the background rates continue to rise. So as we go forward, inevitably, we have to come to a stage where we live with COVID, and I've been emphasizing that we have to learn to live safely and sensibly with a disease that is a serious illness and should continue to be treated with the respect that it has deserved because of the damage that it has done over the last 2 years. But we also need to be getting on with our lives and finding a way to strike a sensible balance between doing the activities that we need to do to make a living and to interact with people, but at the same time not behaving as if COVID has gone away